Welcome to the training for healthcare professionals. Let's begin with the module which focuses on standard precaution. Let's take a look at the key learning objectives. After completing this module, you will be able to apply the basic principles of infection control, perform proper barrier isolation for patients, and maintain standard contact, droplet, airborne precautions. Perform proper hand hygiene. Let us understand the meaning of an infection. An infection is the invasion of a host by pathogen or microorganisms resulting in disease. An infection that transmits directly from one person to another through contact, droplets, or air is known as communicable or contagious disease. Therefore, infection control involves gown and gloves when assisting with direct patient care, using correct hand hygiene techniques. Different modes of transmission of infection are direct contact, person to person, hand to skin. Indirect contact, touching inanimate objects, contaminated equipment or hands of healthcare workers. Droplet, large particles that travel up to 3 feet and come in contact with the host, for example through sneezing, oozing wounds. Air, droplets suspended in the air, for example coughing, sneezing, talking, etc. Let's find out why infection control is important. Infection control is one of the most important aspects of health and environmental safety. Healthcare-associated infections are one of the top 10 leading causes of death. Increase in drug-resistant microorganisms lead to more severe infections. Infection prevention and control help to reduce overall cost compared to the cost of treatment. Let's find out when standard precautions should be observed. Providing direct patient care, handling blood or body substances, performing invasive procedures including cannulation or catheterization, risk of splash or splatter to mucous membranes, providing care that can induce coughing, handling and disposal of waste or sharps, handling or preparation of food. Let's see why contact precaution is important. When germs can spread through contact within and outside the hospital environment, contact precaution needs to be maintained. Patients with weak immune systems are at greater risk of contacting infectious diseases. Following contact precautions informs the healthcare staff of a need for extra vigilance. They can prevent the spread of these germs to other vulnerable patients by wearing a gown and gloves. Let us understand what contact precaution involves. Place the infected patient in a single room if available. The door can remain open. Wear a long-sleeved gown and gloves every time you provide direct care to the patient or when you have a lot of direct contact with the patient environment. Place a sign on the door to remind others who enter the room about contact precautions. Clean and disinfect the room and equipment regularly. Clean hands every time you enter and leave the patient's room. Let's find out why droplet precautions are important. Infection control is one of the most important aspects of environmental safety. Droplet precautions are intended to prevent transmission of pathogens, to prevent the transmission of microorganisms by droplets larger than 5 microns in size generated by a patient coughing, sneezing, or talking. Let's understand what droplet precautions involve. A single patient room is preferred for patients who require droplet precautions. There should be spatial separation of 3 feet between the infected patients and the caregivers or visitors. Patients on droplet precautions who must be transported outside of the room should wear a mask. Nurses must wear a mask in addition to gloves and a gown when working within 3 feet of a patient or when entering the patient's room. After patient use, both linen and food trays must be sent directly for cleaning and disinfection. Nursing staff must instruct family and visitors to wash hands after contact with patient secretions or contact with immediate patient environment. Let us understand the importance of airborne precaution. These precautions are implemented when patients are known or suspected to be infected with pathogens that can be transmitted by the airborne route. They are designed to reduce the risk of airborne transmission of infectious agents. Patients with weak immune systems are at greater risk of contacting airborne diseases. Let's understand what airborne precautions involve. Single room for one patient and door must be closed even if the patient is not in the room. Arrange for, with negative pressure ventilation, earlier known as TB rooms, with 6 to 12 air exchanges per hour. Ensure appropriate discharge of air outdoors, or ensure that a high efficiency filter is in place for room air that is recirculated. Everyone wears high efficiency mask, P2 or N95 masks, upon entering the room. The patient must wear a surgical mask if needed to be transported. Let's find out who can get affected and when. All patients with contagious infections or diseases such as scabies, meningitis, localized shingles, pneumonia, congenital rubella, mumps, diphtheria, rubella, rotavirus, pneumonic plague, TB, SARS, SARS, major draining wounds. Here's a checklist of the items. 1. Gloves. 2. Gown. 3. Masks. 4. Hand wash stations. 5. Soap. 6. Alcohol rub. 7. Towels or tissues. Let's look at how we can maintain standard precautions. Hand hygiene. Hand hygiene is the single most effective way to prevent infection. Wash hands between patient contact. Use alcohol hand gel when hands are not visibly soiled. Natural nail tips should not be longer than 0.63 centimeters, a quarter of an inch, long. Avoid wearing hand jewelry. Personal protective equipment, PPE. Don personal protective equipment, PPE, when having direct contact with patient or equipment in the room. For example, gloves, gowns, masks, eye protection, face protection. Gloves must be worn when in contact with blood and body fluids. Gowns must be worn during procedures or situations where there will be exposure to body fluids, blood, draining wounds or mucous membranes. Masks must be worn during procedures likely to generate splashes or sprays of blood, body fluids, secretions or excretions. Remove and dispose PPEs prior to leaving the patient's room. Patient stay and transporting. Patient stay. Private room or with patients with same disease. Transporting. Limit the movement and transporting of the patient from the room for essential purposes only. Hospital environmental controls. Clean up spills with proper technique and disinfectants. Never recap needles using 2 hands. Discard sharps in approved puncture-resistant containers only. Keep food away from possible infectious materials. Never pick up glass with bare hands. After patient use, both linen and food trays should be sent directly for cleaning and disinfection. Dedicate equipment for individuals on infection precautions or isolation. Points to remember. Standard precautions. Print a standard precaution, stop sign or isolation sign. Organism, disease name, patient diagnosis must not be written on the sign. Single room with own bathroom preferred, or infected patients can be roomed together if not available. If the patient needs to be transported, he or she should wear gloves, or the site of infection should be concealed with an impermeable barrier during transport. Healthcare persons should wear a gown if physical contact with the patient or environment is likely. Separate equipment must be used for the patient and then should be decontaminated immediately after use. Make sure the visitors wear gloves upon entering the patient's room and dispose them correctly after use.